It's definitely not uncommon for babies to cry, but there are ways to soothe your little one. And today we're going to tell you about a two-part program called Sounds for Silence that uses a special CD to calm your baby down.
Typically she'll fall asleep after getting fed in the middle of the night, but we have had times when she's been up until 5 or 6 in the morning, and nothing will calm her down.
Heidi Walters says her 4-week-old daughter Ingrid also gets fussy after her noontime feeding.
She'll cry and cry for what seems like hours at a time, and I don't know what to do to stop her. It's very upsetting because, you see your little baby crying and you feel so bad because you don't know what to do to make them feel better, and, all you want to do is make her feel happy and rested and calm, and I don't know what to do sometimes, so it's upsetting.
So we introduced her to Dr. Harry Zehnwirth, creator of the Sounds for Silence program that soothes unsettled babies.
It's very common for babies to be unsettled. In fact, 1 in 3 babies become irritable in the first few months, and they can cry inconsolably. And we need tools, ways of helping them out.
That's why the doctor turned more than 25 years of pediatric experience into the 2-part Sounds for Silence program that includes a book and a soundtrack. The soundtrack has a Mozart track for when babies are distracted but not fussy, and 6 soothing tracks that mimic the sound your baby hears in the womb.
Sounds for Silence, which is a compilation, a unique combination of sounds, can distract, engage, and then soothe your crying baby.
Dr. Zehnwirth played one of the tracks for Ingrid.
So it sounds to me like it's sort of womb-like sounds. Is that what you're trying to recreate here?
I think so. Babies hear all sorts of sounds. They're fairly loud. They're all the sounds that you're hearing, and plus the placental blood flow, the fetal heart, your voice. And it's a loud environment. It's low-pitched. The reason it's low pitch is because the sound travels through a fluid-filled environment before it reaches the baby's ear. So sounds that babies hear in the womb are less than 500 megahertz.
The doctor says that low pitch is why lullabies don't work as well as Sounds for Silence.
Lullabies are not low-pitched, and lullabies don't remind babies of the womb experience. So they work to a certain extent, but they don't work 9 out of 10 times, and they don't work under 1 minute.
Dr. Zehnwirth says in order for the program to be effective, you have to play the tracks louder than your baby is crying.
Otherwise the baby doesn't hear it. So the volume needs to be set at least at that level. Baby hears it, becomes distracted, engaged, settles. Then the volume can be turned down.
Along with the soundtracks, swaddling is recommended. The Sounds for Silence book teaches a technique referred to as SMS.
SMS Your Baby really stands for sounds, movement, and swaddling. And then they're the 3 core ways, measures that parents can settle their crying baby in the first 4 to 6 months.
The book also looks at other methods to settle your little one.
Sounds for Silence can't be used in isolation. It's a great tool. But with that tool, swaddling, movement, pacifiers or dummies, massage, baths are all useful as well in those first few months.
The program works best for babies 4 months and younger.
So how long would it typically take to soothe her?
Up to a few minutes.
Okay.
But 1 out of 2 babies actually settle under 1 minute.
Wow.
As she's doing at the moment.
Yes, she sure is. She looks like she likes it.
I'm glad, I'm joyful that parents are finding life easier and babies are having easier times of it. And that's my passion, to really make lives easier for struggling parents. And parenting and parenthood is not all rosy. It's pretty tough stuff. It's not for sissies, usually.
The Sounds for Silence program is already a huge hit in Australia, and now it's making its debut here in the United States. For more information about the program, you can go to soundsforsilence.com.